Welcome to Building Equity into Your Network of Partners, a County Health Rankings and Roadmaps webinar. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration between the Robert Wood Johnson and a collaboration with the Robert Wood Johnson Foundation. This program is a result of many contributions of colleagues and partners in Wisconsin and across the nation. Hello, my name is Erica Burrows Girardi, and I'm an action learning coach with County Health Rankings and Roadmaps. I want to take a moment to introduce you to my colleagues who will be joining me in today's webinar. So I'm going to ask everyone to go ahead and turn on their cameras. Let me start with Carla Freeman, who is just outside of Atlanta, Georgia. Hi, Carla.
Hey, Erica, and today I'm going to be checking your questions in the question and answer box. So if you have any questions, feel free to put them in there and I'll try to respond.
Thank you so much, Carla. And now I'm going to shift to Raquel Bornanesk in Portland, Oregon.
Good afternoon, everyone. I'm going to be working in the chat box today. So hopefully I'll be seeing you there.
Thanks, Raquel. And I want to introduce you to our technologist, James Lloyd. And James is in Madison, where our home base is. Hi, James.
Hi, Eric. I'm so glad to be here. And for everybody attending, if you encounter a technical problem with Zoom, go ahead and instant message me in the chat, and we'll see what we can do to help keep things running.
Awesome. Thank you so much, James. And I am especially excited to introduce you to today's guest, Abby Charles. Abby is a program director at the Institute for Public Health Innovation, what we call IPHI for short. This public health institute serves Washington, D.C., Maryland, and Virginia. And at IPHI, Abby provides leadership and coordination for their community health worker initiatives and provides support to a portfolio of other programs. Of particular interest to us today is that Abby is one of IPHI's lead trainers, providing technical assistance to organizations on health and racial equity and the integration of tools to promote equity in decision making. So please join me in welcoming Abby, who is stationed right there in our nation's capital. Abby, thank you for taking time to join us here and share your expertise with us.
Gosh, such an exciting time. I'm really looking forward to this talk today and this opportunity. It's really phenomenal. So looking forward to chatting more about equity in our networks.
Thank you so much, Abby. So let's get back into the webinar. I want to share with you that there will be an exciting opportunity for you to process what we're learning today. After the webinar, we're going to hold an interactive discussion group to deepen your learning. If you've been a part of these conversations, you know that they give you the chance to be face to face with other webinar attendees and gives you an opportunity to share what's happening locally in your community as well as ask questions of other participants. We're pleased to be able to offer these sessions in partnership with Healthy Places by Design. And Joanne Lee with Healthy Places by Design will be our lead facilitator. So watch for the chat for details about how you can connect to the discussion group after the webinar. And Raquel will be sure to chat those out, that link out when appropriate. So let me tell you about a little bit about county health rankings and roadmaps. Most of you know us because of our rankings. We rank the health of nearly every county in every state. Some of you might be unfamiliar with county health rankings and roadmaps, so I do want to take a moment just to share a bit more information about us. I want to start with this question of why. Why does county health rankings and roadmaps exist? We have two primary overarching goals. The first one is to improve health outcomes for all, and this includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where they live or the circumstances that they were born into. We know that the choices that we make depend on the opportunities we have. So I will say that again, the choices that we make depend on the opportunities we have, like opportunities to have access to healthy foods, or opportunities for a quality education, or opportunities to live in safe and affordable housing. Not everyone has these opportunities, and these unequal opportunities create differences in health. These differences don't come about as a result of their own or the actions of individuals alone, but are often the result of policies and practices at every level that has created deep barriers to good health for some people. So we see this manifested in things like bank lending practices and school funding based largely on local property tax. That means that not everyone has a fair and just opportunity to live a long, healthy life. But community leaders and residents like you all have the power to change this when you work together to make communities equitable. So that way, no matter where you live, no matter what your zip code is, you could be in Portland, Oregon, where Raquel is, or you can be just outside of Atlanta, where is, but you will have the resources to make healthy choices. This is how we build a culture of health across the United States. This is an image of our take action cycle. We sometimes don't show this image that often in our webinars anymore, but I wanted to dig it out today. I call it an oldie but goodie because it shows that in order to build a culture of health, multiple partners have to be included in those action steps you see in red around the outer part of this cycle. Let's look at the heart of the take action cycle. What you see there are people working together. We know that when people work together with a shared vision and commitment to improve health, it can yield better results than when working alone. Now, these are just some of the sectors that would need to be at the table to create health solutions. And that is the reason why we're going to be talking about networks today. Let's do some table setting for a little bit. Like, what do we even mean when we say the word networks? Networks show up in many ways, but one of the things that they often have in common is that the members are connected with a desire for the same outcome. Sometimes networks are created informally. Like, for example, a friend of mine who is a doula connected me to one of her colleagues. And the three of us live in different cities within the same county, but we have an interest in creating equity for families in the birthing process. And now that the three of us are connected intentionally, we're growing our network and we have a goal of creating a podcast next year. And by the way, I don't think I told you all, but I'm right outside of Daytona Beach in Florida. So that's where that's where I've been connecting with these doulas. And then other times you're going to see networks that a little bit more formally organized. So it could be a group of organizations that are connecting to share knowledge or resources. So the networks can also serve as an approach to multi sector collaboration. They provide a pathway for building, enhancing, and managing relationships. One thing that I want you to remember is that networks can help us make the most of these connections. For example, networks can help us consolidate skills and expertise. Take, for instance, that Abby and I work for what's called a public health institute. Now, the majority of the states in our union have a public health institute, and most of those institutes focus on public health infrastructure supports like health policy and training. But each institute has like a focus area where they have expertise. Like, for instance, at UWPHI, we house the County Health Rankings and Roadmaps program. IPHI, where Abby's located, has expertise in racial equity training, among other things. So, because I'm a member of a public health institute as well as Abby, she's in my network. And here's the cool thing about networks: Abby is the only person I know at IPHI, but because Abby is my tie to that institute, I can call on her for expertise. And if Abby doesn't have it, she can connect me with someone else at IPHI who does have the expertise. And then both of our networks, or both of our public health institutes, rather, are connected to an even broader network. And that network is called the National Network of Public Health Institutes. NNPHI has members located in all of the shaded areas you see on the map, and also Washington, D.C., where Abby is, and Puerto Rico. I think you see where I'm going with this. Because we are connected to this broader network, expertise is always just a call away. So, as we go through the rest of today's webinar, I want you to think about what informal or formal networks that you belong to so you can have a frame of reference as we begin to think about building equity into the networks that we're a part of. So, I'm thinking that we all want to make the most of our networks, right? So, I want to ponder this question. What actually makes networks strong and successful? Is it more members? Like the more members in that network, the better it will be? What about friends in high places? What about that approach? Perhaps having the right members at the table will make us successful. Is diversity the key to a strong network? Maybe if we just brought in more sectors, we would be very, very strong and very successful. And then some may think, well, if we include the population affected by the problem that we're addressing, then we're good to go. In actuality, while all of these factors may help, what our guest Abby Charles would argue is that without equity in your network, you cannot reach your full potential. So, with that, I want to reintroduce you to Abby Charles. Again, Abby is the program director at the Institute for Public Health and Innovation. And when I read this quote by Abby, I knew this webinar was going to be really thought provoking. It was actually in a return email to us when we invited her to join us today. So, Abby, again, welcome. And I want to start with a question that I know is kind of circling in everyone's head, and that is, why is equity important for networks?
Yeah, and thanks for that initial question, Erica. It's good to level set. And what we've seen with COVID-19 for sure is that there are such deeply rooted inequities in our society. And that's led to some racial groups facing poorer health outcomes than others. What we know is that we can't just deal with these surface level issues any longer in order to address these disparities and inequities. It's not enough for our networks to be able to critique and say, oh, wow, yes, there are racial inequities. We need to be able to know how to create and proactively build equity in our society and in our communities. And to fully understand those complex challenges that have led to us seeing these inequities in issues like COVID and many others, we have to get to the roots and the role of race and racism and really begin to understand that and how they intersect with sexism, classism, homophobia, ableism, ageism, and other forms of exclusion and oppression in order to really begin to deal with those issues. So for networks, whether you're a network of organizations addressing housing, food access, community health workers, education, criminal justice, violence, asthma, public health, increasing access to education for physical therapists of color, there are inequities that we see based on race and other forms of oppression. And sometimes it could seem like these issues are way too complex. So we try to take care of the issues at the surface. So for example, a network that might be dealing with obesity might look to support increased access to exercise or healthy foods in the immediate phase. But when we really think about how are you doing equity work, or they think they're doing equity work because we're increasing exercise for people of color. But
Mhm.
providing exercise is just at the surface, right? And to get to the roots, we have to dig into whether people have the jobs that they need to be able to afford food in their communities, whether they're living wages in those communities, whether there's safe routes to exercise. So we have to dig a lot deeper. And,
Right.
we have to place equity and racial equity at the center if we want to reduce racial disparities.
I love that. And it's all about thinking about, we're gonna get into this in a little bit. So I don't mean to jump ahead, but it's all about getting to those root causes. And we're going to talk about that in just a second. And but I wanted to ask you this question because one of our guests who is from New York, she's one of the folks that's participating on today's webinar. And she asked this question when she was registering is like, how do we begin the process of leading with equity in a network? I mean, we may already have a network established. So how do we begin to lead with that?
Yeah. Well, and I love this slide from the Annie Casey Foundation. It's an adapted outline of 7 steps that they've defined to advance and embed racial equity and inclusion within an organization, right? And we've added one, which is thinking about how you coordinate funding and investments for
Hmm.
equity. But what they recommend is that you start with level setting. What is equity? Is everyone on the same page about what we are talking about when we talk about we want to address equity and racial equity? Has everyone been trained to really understand what are the principles of equity that we as a network buy into? And have we done an analysis of how racial and other forms of equity play out in our network? That's a critical first piece. The other piece, and even though these are listed as steps, they can all be taking place at different times, right? So this is not necessarily to be done in this order. But the other piece is really digging into what data do you have that documents that there are inequities. So whatever issue you're looking at, where do the inequities lies, right? Where do the inequities lie? And what is the data showing? What isn't the data showing? What are we missing? Are
Right.
we collecting our data in a way that even identifies inequities? And that's a critical piece that networks need to look at, right? So even if you're dealing with access to universities for certain communities, there are going to be certain states that face different inequities than others, right? Ensuring that you're capturing that data, regardless of the issue that you're looking at, is going to be important. Of course, when you're addressing equity, you want to make sure that the people who are most affected by those inequities are leading the discussions and the
Right.
decisions related to that issue. And that's a big piece that, for networks, and a lot of us do this, it's hard to think about how do we change what our leadership looks like to ensure that the decisions are made by the communities most affected. So we need to know, do we have the right groups involved? Who else needs to be involved? What tables do we need to go to? Not just bringing people to our tables. And how are decisions being made? We need to question those things. We really need to get to the roots. And I was talking about that earlier, and we'll talk about that a little bit when we get to talk about data as well. But investing in not just the surface level issues, but investing in those roots is going to be a key piece for your network as well to truly be doing equity work. The other piece is, oftentimes people implement programs and they think, we're dealing with equity, but they haven't really sat down and assessed or dug into what might be some of the implications of implementing this program. And in essence, they inadvertently harm the groups that they're trying to help,
Yeah.
because they haven't done a deep dig into what might be some of the risks of implementing this program. So we're going to talk about one of the tools that we use, which is an equity impact assessment tool, to
Mhm.
really navigate and assess those programs or policies that we're implementing to figure out how we might be harming others. And then you want to evaluate from an equity lens. You want to make sure that you are assessing the work that you're doing to
Mhm.
see what are our impacts on equity, what are our impacts to the roots that are driving those disparities that we're seeing as well. And like I said, you want to make sure that you're funding this work. So if you have a group that you've targeted to support increasing equity within your network, are they funded? Is their time supported to ensure that this is working? Have they paid for the trainers to come and train you on
Right.
what equity means? Like, how are you budgeting to ensure that equity is a priority for your work as well? Hmm.
Yeah, it's all about putting your money where your mouth is, right?
Hmm. Hmm.
Well, I'm gonna shift the focus for just a little bit. I'm gonna ask you to pull your microphone up too because it's hitting your collar. Yeah, no
Ah,
worries. Yeah.
No
Oh, and
worries.
you sound so much better. I love it. We talk about how important data is to this work. So, hey, and I want to say for our audience, I know this is a lot of information that Abby is sharing. So, we're going to kind of talk about these different nuggets like data and like you were saying root causes and stuff. I want to remind you all that you can join us for the discussion group where we can unpack a lot of this stuff that Abby is sharing with us today. But in the essence of time, I did ask her to give us a broad scope of what really needs to be included in building equity into your network. So let's
Right.
shift and talk about data and the role that data has because we're County Health Rankings and Roadmaps. So we know the importance of data.
Right. Right. Yes, and I'm sure your network does as well. But so we want to use data to identify inequities, right? So that's the first piece, and we could use qualitative stories as well as the numbers, quantitative data, to dig into the roots of inequities as well, right? So I want to show us an example of how we use data to highlight inequities. So this is a map of DC. This comes from DC's Health Equity Report. And what you see here, although it's really small, in that first little corner on your on the left hand side of this image is the percentage of non-Hispanic Black people in DC. The little corner up at the top on the right is the percentage of the non-Hispanic white population in DC. And at the bottom two images are the non-Hispanic Asian population and the non-Hispanic Latino population. Thanks for moving that mouse. And keep that in mind. I want us to focus in on the population of Black people in DC. And let's pull up another image that shows us where the rate per 10,000 of pediatric asthma emergency room visits, right? And what we see here, where it's the darker green, is that you see that there are higher rates of asthma visits to the emergency room in the same communities where those Black people in DC live, right? So what we're seeing is that there's higher rates of emergency room utilization for children in those communities, right? Why? That's one of my
Right.
questions. Why, right?
Mhm.
So let's pull up that next image, which shows us what are some of the insurance rates for our community in DC. Now, DC has a very high insurance coverage, right? It's about 95%. But when we look at this data, what we see here, and the darkest green shows the highest insurance coverage, and the lightest brown shows the lowest insurance coverage. And what you see when you look at the city is that in those same places where we have that high emergency room utilization for asthma, we also have the lowest insurance rates.
Mm.
Even though they're still high, there's disparities and there's inequities. So you have to be able to show your data in such a way. So we have high asthma, we have lower insurance rates. Let's look at the next images. And what we see here as well is same asthma image. Let's look at income. And in those communities, what we're also seeing is that where do we see the darker blue, which is where there's lower income, right? So
Yeah.
these are populations where you see income less than 15,000, right? So you're seeing that there is lower income in these communities as well. Now, if I just showed you all of that data, sometimes what triggers in our mind is the implicit bias that we've been hearing time and time again related to personal responsibility and the choices that certain communities make, right?
Yeah.
But in reality, let's pull up that next image and look at the historic outcomes or
Mhm.
the history in DC. And what this map shows is the legacy of racial covenants in the District of Columbia, right? Where
Mhm.
from between 1940 and well, before 1948, what we had was restrictive policies in DC where Black people could not buy housing beyond where those dark red pieces are on this map, right? And what that law facilitated was there was no investment, or there was much less investment in communities where Black and brown people lived, and there was investment in white communities, right? So those racially restrictive covenants affected how our housing looked, how investment in retail looked, whether we had groceries, all of those other pieces in these communities, how many
Mhm.
hospitals were built in those neighborhoods. So when we think about, and if we just put the image of where asthma is, we might create one narrative and said that, the majority of asthma emergency room visits are by Black people in the District of Columbia. But when you add the roots and the drivers of what leads to these communities being disinvested in, it creates and paints a different picture and a different narrative. So we want to
Yeah.
show the data, but we also want to use data to build that narrative and show the roots of the inequities in our city. Because what that tells us is that we need to be investing in much more than just asthma education. We need to be investing in much more than just medication access. We also need to be investing in those communities to ensure that housing is healthy, housing is not unhealthy, etc. And our networks can do that better by digging into those roots in our cities and our communities.
So, I mean, the take home message is that looking at one set of data is really just giving you such a narrow snapshot that you're really not fully informed enough, probably, to make the right equitable decision, or the decision that's going to lead with equity. So,
Mhm.
that take home message, you've got to look at all the data that's included, as well as, um, eh, you know, um, you need to engage those who may be having that lived experience. And this is where
Mhm.
I want to shift and talk about power,
Mhm.
because let's say engaging people in those neighborhoods requires shared power.
Mhm.
And so I remember hearing you say, you can't talk about equity, Erica, without talking about power. And that
You
gives
can.
me goosebumps. Let's
Mhm.
unpack that a little bit.
Yeah, and I saw a quote yesterday that said you can have 100 people from the community and 100 community members involved in a network, but if the policies, practice, and trust stays the same, that's 100 more people that are harmed by those
Wow.
policies, right?
Yeah.
Power plays such a significant role in equity, with how we interact with the communities most affected by inequities. But sometimes we don't even analyze what the power dynamics are like in our network. This slide is from a Advocates for Youth presentation newsletter from like 2002 called Transitions, and it lays out so well the different ways that communities are engaged, and how power dynamics play out with community participation. We talk a lot about having communities involved in decision making, but it looks very different for different networks. From co-opted, where there's this level of tokenism and we're selecting who we want to have involved from the community, to the space of collaborating, where we're working with the community, outsiders and community members. We're sharing and deciding what priorities are, but responsibility still remains with that outside network for directing the process. And then collective action, whereby the local group, the communities most affected, the people who are most affected by the policies, they're deciding this is what our priorities are, this is what we
Mhm.
want. And let's work with these professionals to get some insight, but we own this, right? And there's a different level of outsider control and potential for sustainability and ownership when we have networks that are led by the communities that are most affected, right? So the real equity work and the real digging is going to happen when we get to that space of collective action, but that takes trust. So power plays
Yeah.
out in even identifying where does our network lie and where do we want to get to, and what's the work that we're going to put in to get there, right?
Yeah, I mean, I can honestly say I have been parts of networks where we kind of stayed in that co-opted space, and
Mhm.
that
Mhm.
collective action space. I'm not sure if I've ever truly seen that, but I'm looking over here at this part of the table, and we see that this is where, let me go back, and didn't mean to bump it forward, but we
Mhm.
can see that this is where things are more likely to be sustainable if we
Right,
can get
right.
to that collective action, right?
Yeah, and when we value collective action too, right? Because there are
Right.
networks that are collective action networks, right? I think of
Mhm.
like the Community Health Worker Association. There's a National Community Health Worker Association that is led by community health workers, right? So taking action, stepping out front, and they are the ones owning it. We also have to value that as funders, etc., and fund that work to make sure that that continues to move forward. So it's critical to think about this exists, it's out there, we
Right.
can learn so much from those types of networks that are doing the great work. The other piece that we want to think about with power as networks, and we should be analyzing this, all of us,
Mhm.
every single network.
Mhm.
How do the different types of power manifest in our networks, right?
Mm.
And, when we want to think about invisible power, visible power, and hidden power. And being able to identify how power is showing up is particularly important because power defines how inclusive a partnership is going to be,
Yep.
as well as what policy decisions are made as a result, right? So when we think about invisible power, that's chances are that's who's managing this network, who's coordinating, who's the backbone, who's the leadership of this network, and that sort of shapes the decisions, right? So it's how decisions are made, it's who decides who gets to be involved in this process. I get to send the invitations out. I get to say, these are the persons who get to be involved. This is what the agenda looks like. I'm shaping the budget, et cetera, et cetera. But then there's this hidden power, right? So it includes decisions that are made to decide who even gets to be the decider or involved in this group, right? It has to do with who decides what's the issue that we're addressing, right? Sometimes you might think of funders in this space because they've already written the grant, they've already said, this is what you're going to be doing, right? We have this cooperative agreement and we want you to do this. Yeah, you could have your community priorities, but we've already set this. So there's this hidden power that sort of shapes the politics of
Right.
your network. And I want our audience to think about, how does this play out in your network, right? And then there's this invisible power, which ties to those narratives that shape even the understanding of the issue, right? And shapes
Right.
the meaning of the work that we're doing. So it has to do with superiority, inferiority, the implicit biases that we hold, the beliefs, the sense of self that we have when we think about even an issue like obesity. If the meaning what shapes our meaning in the work is that, people aren't healthy because they're not exercising, that's going to be that's going to affect how we work. Whereas if the narrative is people are obese because of the access that they have to resources,
Right.
then what we invest in might look very, very different. So that hidden and invisible power also plays a critical role, and we need to analyze how those play out in our networks so that we can know how to address equity in a different way.
Yeah, we're going to talk about that in just a second. But, remember, folks, I asked you, I said, be thinking about what informal or formal networks you belong to so you can have a frame of reference. Right now, I'm going to ask you to think about those networks and think about those power dynamics that might be in play in those networks that you belong to. And just drop in the chat if you've seen visible, hidden, or invisible power manifest itself in those networks that you belong to. Please don't name the network. We don't want to know the name, but just tell us, have you seen one of those or all three? Because I mean, I have been in network. I mean, I've been in. Well, I'm not gonna tell y'all how long I've been in public health, but it's been a long, long time. And I've seen this show up, and I've never even thought about that invisible power, and that's powerful. A narrative can be powerful. It really directs. It can direct, like you said, where those resources are gonna go. Just how, your response to the issue can be driven by that invisible power. But like you were saying, assessment is important. Like, how do we know whether or not our networks are even operating with these power dynamics? So how would we even deal with that? Where do we go with that?
Yeah, and so we use this very, very simple tool, and we sit as a group to think about how do these pieces play out, right? So what's the visible power? Who's represented? How inclusive is decision making? What examples do we have that this actually has worked out? And how are we going to shift that? What's going to be our responses and strategies to address that so that our visible power is more inclusive? Similarly, with our hidden power, who's deciding who's at the decision table and who decides the agenda or who decides which tables we go to, and just analyzing and having clear and open discussions about that as a group helps us to think about, all right, if we want to shift this to be more inclusive, what can we do to address that hidden power? Who's who do we need to talk to? How can we have conversations with our funders about the fact that in order to address equity, there are certain things that we might need to shift? Who do we need to advocate with? And then as it relates to invisible power and that implicit bias that drives the meanings that do our work, right? We have to get on the same page. We have to build
Right.
trust. We have to have that level setting. We have to have training on implicit bias and understanding our biases and how they work out, and do the analysis to figure out what's shaping the meaning of the work and how can we work to shift this a little bit differently. So we ask these questions to think about what would you do differently in order to distribute power more equitably in your partnership, and how do these
Great.
types of power play out. But most networks aren't necessarily asking these very clear questions
Hmm.
about power, right? So
Right.
we know about, we want the people with lived experience involved, but we're not necessarily navigating the power. And if we don't change the power dynamics and we bring those groups in, we might run or cause some toxic harm.
Right, because what you're doing, you're not really creating a space for them to actually contribute to the conversation. You're just like putting them at the table and completely ignoring what they have to offer. The cool thing is, guys, is that we have all of these tools that Abby is showing you. I know there's a lot on the screen. Some of this stuff is hard to read, but that's okay because we have the links for the tools. And Carla has gotten them all together for you in a resource guide that we're going to be sharing with you. And those resource guides, as you know, if you've been on our webinars before, they come to your inbox. So you'll have them tomorrow, or at least within 24 hours of our webinar. Um, Abby, I want to shift to leadership. That is another ingredient to networks. And tell us, how does um, network leadership lend itself to equity? What has to happen?
Yes, critical to think about. So I say it all the time. One of the key parts of equity is ensuring that we have affected communities involved in leadership and decision making. And a lot of networks are, when we talk to organizations, collaboratives, networks about this, it's like, okay, well, we need to build relationships. So network leadership has to be a strong relationship builder. And we know that takes time and resources, right? You have to be able to build relationships and trust with communities that are most affected in order to engage them in such a way that they want to be involved in leadership and decision making, and to ensure that this is also a priority for them. So having that commitment to community driven solutions to community based problems is going to be an important piece, and advocating for and defending those community based solutions and approaches is going to be a key part for leadership. I say seeing distributed leadership across networks is also important. So when one entity makes all the decisions and gets all the funding and has all the power, that looks less equitable than when there's distributed leadership. So there's multiple organizations that are involved in decision making. There's multiple organizations that share funding, that think about how resources are allocated, that design agendas, that make decisions. That's a critical piece too. The other thing that also sort of determines leadership is how decisions are made. Are
Hmm.
you as a network voting majority rule? Because sometimes majority rule may not be the most equitable way, because it's decided by who's able to show up at meetings or who's able to
Right.
be there to vote versus ensuring the equitable voice of your community. So thinking about processes like consent-based decision making and principles like consent, that allow for more equitable and inclusive voice in decision making is
Right.
going to be a critical piece too. Of course, transparent and clear communication from your distributed leadership is going to be a key piece. Regular newsletters, regular communication about what's happening, how we're changing. And, at the core, it is that the leadership of the network is rooted in the principles, values, and goals related to equity. That's going to be critical, that the people who are leading this work buy into every aspect of
Yeah.
equity. Mhm.
Yeah, thank you for that. I just wanted to lift this question. I wanted to tell you that when Carla and I were preparing for this webinar, she asked this question I thought was so important, I decided to lift it. And it was, what if a network or a partnership is just unwilling to change? And I want you to consider that question because I thought it was a good one because we don't want to make this seem simple, right? We don't want to oversimplify it. Doing this type of work, shifting power, making sure that we're being inclusive. It takes work. And if you're going to be doing business in a different way, it means letting go of some practices and stuff they've probably been just baked into the work that you've done for potentially decades. I don't know. So I would love for you to ponder on this question. And for those of you who are in our audience, I want to ask you, have you been in a position where you've seen the need for change and needed to convince your network to respond appropriately to inequities? And if so, how did you convince them? So I'm going to ask you to just put that into the chat and I'm going to circle back to Raquel in a few minutes. But for now, I just want us to have like a conversation, Abby. And I just want you to what happens when there's that unwillingness to change?
Yeah, yeah, and it's difficult. So there's a couple things that if you are that lone person who recognizes, listen, what we're doing isn't really equity. We're saying we're doing equity to check off a box, right? Because it's, in order to meet certain standards or to get accreditation where we're doing certain things, but in reality, this work isn't really equitable. Um, what does your data show? So what are the stories? What are the narratives? Do you have data that highlights that there are inequities and that we're not working on these inequities? Can you use data to support advocacy within your network or within your collaborative or organization to speak to the fact that we have to make change because this is what's happening in our communities, right? That's one piece. The other piece is building relationships, both internally with others who may share similar sentiment, as well as with the communities that are most affected, right? Because sometimes getting that external voice
Mhm.
activated and involved and partnering or can also create some additional visibility on why it's important for your leadership or for the leadership of the network too. The other piece is that level setting and potentially advocating for getting everyone on the same page about what is it when we say we're doing equity, this is what it really means, right? So
Yeah.
we're not doing this. And how can you maybe advocate for that type of training in within your institution as well? I say it takes one voice, one consistent voice. Sometimes that's really hard to be that voice
Mhm.
advocating for that change. And we know that there are active voices against racial equity. There are active voices that believe that racism is not an issue and that
Yeah.
racism does not affect our outcomes in our communities. And we have to be the voices that state, no, we know that it is. This is what the data shows. This is how we're going to have to change it because when racism affects one of us, it affects us all.
That's right.
So
I love that. And
that
so what I'm
that's
hearing
what I'd say.
and I hear you saying lean on the facts, lean on data because this way you're taking your opinion out of it. Lean
Mhm,
on that. And then I know I want to just well, let me real quickly. I know we're starting to run out of time, but I just think this is important to share. I want to go right back to that last point that you made,
mhm,
rooted in principles, values, and goals related to equity. Remind folks if this is what we are saying we're going to do, if this is our value, then we have to show it because your mission may say one thing, but your values always reflect your actions.
mhm.
Your actions are reflected in your values. And if you're saying that you value inequity, this is what you have to do.
Yeah.
So Raquel, very quickly, what are some things popping up in the chat? And then we're going to talk about some tools that Abby is going to share with us.
Mhm.
Oh my gosh, the chat has been very, very active. It's really wonderful to see so many people engaged in this webinar. All the credit goes to Abby on that. So folks are saying, just keep showing the data. It's really a work in progress. We need to provide evidence-based cases to prove the need for change. Persistence and patience came up, which is always good to remember. Provide and measure the impact in the community. If the
Hmm.
needle isn't moving, then you've got to change your approach. And we know this will will change the approach. Keeping direct and transparent conversations going to focus on the ideal and explore alternatives, including the consequences of the actions being considered.
Very good.
Keep reminding people of their mission and that the
Yes.
work is always evolving. And we learn from what works and doesn't work. And if something works better, let's get it into our mission and start doing that. So
I
love
love it.
stuff. Very, very cool.
Well, thank you so much, folks, for being so engaged in the chat. I totally agree, Raquel. I told you this was going to be like an awesome webinar, Abby. This is great stuff, Abby. And one of the things that we promised the audience is that you were going to have some tools to get them started with this work. I know we're running out of time. So if you could very quickly just quickly introduce us to each one of these tools. Again, folks, these tools will be in your resource packet. You're going to see lots of writing. It's going to be hard to read. Just listen to Abby and check out your resource packet tomorrow. Okay, let's start with Annie Casey. What she's got
Yeah,
going on with this
so
one.
and I already mentioned the power dynamics tool. So you want to assess your power dynamics. We also have a tool where you assess who do you have engaged in your network, right? So what organizations that are dealing with an issue, if housing is the issue that your network is focused on, you know that housing isn't the only group you need to have involved. You should also have economic interests involved in the table. You should have employers and businesses involved in that discussion as well. So thinking about how do you expand your network to reach as many different groups that can affect the roots of your issue is going to be important. The other tool that we say is that Annie Casey organizational self-assessment, which is a really short tool. And although I showed Annie Casey, there are many organizational assessments that you can use because these tools, they have a range in length and depth to get into your network to really understand how does racial equity show up in our work. The other tool is our root cause analysis. So for any issue, you want to dig deep and ask 5 whys as to why does this issue show up. And most times your fifth why, you'll get to the policy, systems, or environmental change that needs to be made to really affect that problem. So we suggest doing a root cause analysis as well. The other piece is this continuum of becoming an anti-racist multicultural organization. So if racial equity is an issue that you're interested in addressing, where do you lie? Where does your network lie on this? And where do you want to get to? I'm not going to tell you where you need to get to or anything like that. You as a network will need to analyze and determine where as an organization do you want to get to and what steps would you need to take to achieve that. This is done by Crossroads Ministry in Chicago and is a great tool to utilize and look at.
Nice. And then the impact review. That's important.
Yeah, so the last tool that we use is an equity impact review tool, which helps us to think about what might be some of the unintended positive impacts of any program that we implement or policy systems change. What might be some of the unintended negative impacts? And how can we amplify the positives and minimize the negatives? So we use this tool. This is just one snapshot of the longer tool, but it must be done along with community, along with the people who are most affected, to really think about how might implementing X potentially negatively affect me, even though we don't even realize that it's negatively affecting my community.
Yeah,
So we
that's
use this.
important. Measuring impact is important. That assessment is critical because, like you said, those unintended consequences is something that we just don't want to do, and it can happen.
Yeah, and I could give more examples of those in the talk after.
Okay, cool.
And,
And then,
overall, when it comes to dismantling inequities and our role as networks, for us, we establish these 3 primary principles or pillars. We want to identify disparate and inequitable outcomes. So we want to look at health outcomes and traditional risk factors. We want to look at the distribution of social, economic, and environmental determinants of health. And we want to disaggregate our data. If you're not disaggregating your data, you may be missing a lot of inequities. And when we think about data, it's thinking about what shows up and also what is not showing up. What might
True.
we be missing that we need to do more assessment of in order to really understand these inequities? We want to include communities. So we want to partner with and learn from affected communities. We want to partner with agencies and advocates, assess and discuss and address the power dynamics in our networks. And we want to budget for equity. So, how are we
Yeah.
ensuring that we're allocating our resources to really dig into what we need to be digging into? And then we need to expose the systems that are creating racially inequitable outcomes. We want to ask who's marginalized, why are they marginalized, what are the policies, systems, structures that are creating those outcomes, and how can we intervene to change those outcomes? Who do we need to engage? What policies do we need to inspire? And how can we make sure that the strategies that we are implementing do not disenfranchise anyone through that equity impact assessment tool? So, really think about what's your network dealing with, where the
Hmm.
inequities lie, and how can I, as a network, begin to address those inequities in a real way?
Thank you so much. Don't leave yet, and folks, don't leave. We are actually got a little bit more we want to share with you, but right now I'm going to ask James to launch a poll, and I'm going to ask you all to be really honest. I am just curious, like how much did this webinar improve your understanding of what's needed to build equity in your network of partners? I'm just curious, and I certainly appreciate all of this good information from you, Abby. Um, and so go ahead and take a second to respond to that poll. And I'm actually going to share next a tool that is with county health rankings and roadmaps. So let me go ahead and pull that tool up. And James, you can close the poll. Thank you so much, James. All right. So Abby was telling you how important it is to do some level setting, right? With your group, with your network, with your partnership. I want to tell you about our suite of equity guides with our action learning guides. And what these will do is these guides will help introduce you and your entire network to equity. We have to be on the same page. Abby was telling us before you can make that step forward, you have to be on the same page about what is equity, understanding those root causes. I want to encourage you to dig into these action learning guides about equity, root causes. We even have one about how to partner with residents because they are so critical to the work that you do. So, of course, that's going to be in your nifty resource guide that Carla has put together for you. And I want to let you know that Carla, Raquel, and I are part of a team of coaches that you can connect with throughout the year. I can tell you there's nothing that we enjoy more than talking to community champions just like you working to transform your community. So if you have a question about any of these tools or if you want to navigate your data, so look at some of the disaggregated data that we have, we can help you do that. So reach out to us. The best way to do that is to use our contact us button on our website. Now, in just a moment, we're going to shift to the Q&A session because I know there's been some questions that have come up for you, Abby. Please make sure that any
Mhm.
questions that you want to ask Abby are in that Q&A box. And in the meantime, I'm going to ask Raquel to chat a brief evaluation for the webinar today because we take your and I'm going to ask you to just open up the actual evaluation by clicking on that link and save it for later. But I do want to encourage you to complete that evaluation because we actually do look at your feedback and we use it to make our webinars better. So I want to thank you in advance for filling that out later. And thanks, Raquel, for chatting that out right now.
Mhm.
As you begin to think about equity, another step that's so important to your networks is policy. So, if you're thinking about policy in your complete community health planning work, I want to make sure that you are here for our webinar on November 17th because we'll be featuring Sarah Degay with Change Lab Solutions. And Sarah will be sharing strategies for effective, sustainable health policy. And you can register for that webinar on our website and so I hope to see you next month. So at this point, I just want to shift it over to Carla. Carla, what kind of questions we've had? I think we've got time for maybe one or two.
Holy moly. So I just encourage folks to come on over to the discussion group to get deeper. So I'm going to try to synthesize it pretty quick for you. Building trust, specific, and they're talking about specific populations, mainly underserved populations, Black and Brown communities, as well as the police. How do you bring them into the fold and build trust as well? And then this whole notion of holding organizations accountable when they do sign on to equity. How do we make sure we do it? And finally, again, some of these may go over to discussion group as well. How do we make sure people are doing true equity versus this shallow equity as checking the boxes and not really going deep? So
Mhm.
there you
Yeah.
go.
And Carla, I saw a question about compensation
And
for
compensating
community
community
members.
members, yes.
And that comes up a lot. And I know some funders don't want quote unquote stipends including or incentives included in their budgets. And I say all the time, like community and lived experience is just as valuable as your professional experience. So when you are developing your budgets, consider including community voice as a consultant. Include it as a line item under consultants in your budget and really value their time to participate in those meetings from a budgetary perspective. So let's move away from thinking of it as an incentive or as a stipend, and really dig deep into how to invest in that voice as a valued member of your decision making process. The other piece I saw was someone talked about federal grants sometimes can be very limiting with regards to, if you're funded for a specific program, how do you ensure that you are digging deep into equity work? And I think that's where your partnerships play a role. So if you are limited by the funding that you have, how can you be involved with other groups in your community or in across the country or other stakeholders that are digging deep, that are funded differently? So that's going to take relationship development so that you're not using your federal dollars to do that piece, but that you're partnering with the entities to maybe provide the data that they may need, and recognizing that there are others who are doing this work in an equitable way in your community. So sometimes it just takes that relationship development to be able to do the work differently.
Thank you so much, Abby. We so appreciate you. And folks, right now, Raquel is chatting out that link to our discussion group. And so as we wrap up, I do want to again invite you so we can unpack some of these topics that have come up, and you'll get a chance to engage face to face with others who have been a part of the in the audience of the webinar, and you'll be able to ask questions of other participants and share what you're doing locally. So I hope to see you over there in a few minutes. I want to let you all know that we have a presence on Facebook, on Twitter, and please do stay connected with us in one of those ways. And one of the best ways to get can stay connected with us is through our newsletter. So you can sign up for our newsletter. There'll be a link, of course, in the resource guide, but you can sign up for our newsletter. And this is how you'll get information about our upcoming webinars and any new tools and resources that we have available to you. So please make sure you do that. And before I leave, I want to thank my colleagues, Carla, Raquel, and James for helping me and produce this webinar. And of course, Abby, thank you so much for just sharing your
Pleasure.
expertise and knowledge. I just so much, I learned so much even preparing for this webinar. And for you, our audience, thank you for sharing an hour of your day with us. I hope to see you all in the discussion group, and I want to see you all on November 17th for our next webinar. Have a good afternoon, everyone.
Thank you.
Thank you, Abby.